Assalamu alaikum. I just want to go through some of the important structures, mainly neurovascular structures of the arm today. So first of all, we have this huge vessel, so axillary artery between the lateral cord. This is the lateral side. You can see this is the deltoid, lateral cord, and the medial cord. Here you have the scapular nerve, subscapular nerve, and right next to it you can see this is the quadrangular space. Here I'll mark the boundaries in a minute. Just look at these structures first. So this is the medial side. You have the axillary nerve and the posterior circumflex humeral artery. Axillary nerve and posterior circumflex humeral artery right above the latissimus dorsi. So if I turn the model, this right here is the quadrangular space. It has three boundaries. Superior boundary made by teres minor. Medially you have the long head of triceps, and inferiorly you have the teres major. Teres minor, long head of triceps, and teres major. So this is minor, this is major, and here you have the quadrangular space. Okay. So from here, this axillary artery, after entering into the arm, is called the brachial artery. This is the brachial artery, and this is the lateral side. Again, this is the medial side. On the medial side, you have medial side of brachial artery, you have the ulnar nerve, and on the lateral side, you have the median nerve. So ulnar nerve, brachial artery, and median nerve. And if I remove, this is the biceps brachii, by the way, and these are some branches of the brachial artery. So you can see the ulnar nerve is moving posteriorly and it will enter into the forearm. However, here you have the median nerve crossing over the brachial artery and it's continuing into the forearm here. So this is the ulnar nerve and this is the median nerve crossing the brachial artery and entering into the forearm. And this is the brachial artery entering into the cubital fossa. Here it divides into two branches, radial artery and ulnar artery. Radial and ulnar. Remove this to show you. So again, the radial artery and the ulnar artery. It will start from here, and after giving these branches, it will continue down along the medial side of the forearm. So the radial artery will first of all give the recurrent radial branch. It will move upward. This is a recurrent radial branch, recurrent radial branch of radial artery, and right here you can see the radial nerve, recurrent radial artery and the radial nerve, and it's giving these muscular branches, and this is the radial nerve traveling down. This is the radial nerve and these are the branches of radial nerve. So recurrent radial artery and the radial nerve, you can see all radial artery, you can see this is the entirety of the radial artery. See here, this is a now it's dividing into two branches. This is a superficial Palmar branch, it will enter into the hand, and this one it will enter into the anatomical snuff box, and then it will reach the dorsum of the hand. So okay, so this is the ulnar artery. First of all, this is its path, and this one is the common introitious artery, and the common introitious artery divides into anterior and posterior introitious artery. So this one is the anterior introitious artery, and this one would be the posterior anterior introitious artery. Then you have this nerve. This is a median nerve. It will continue into the hand. As you can see, it's continuing entering into the hand. Median nerve, and it will also give anterior introitious nerve, median nerve, anterior introitious nerve right next to anterior introitious artery, and this is the ulnar nerve. So we have from lateral to medial, this is the radial nerve, radial artery, anterior introitious nerve, anterior introitious artery, median nerve, ulnar artery, and ulnar nerve. Lastly, we have some structures in the hand. So again a revision: ulnar nerve and the median nerve, ulnar artery, and this is the radial artery entering into the palm of the hand. Okay, so this is the Palmar digital artery and nerve, and this is the ulnar artery. It will contribute in the formation of superficial palmar arterial arch, and from here the superficial branch of radial artery will also help in its formation. This is a superficial palmar arch, and you can see these vessels coming out of this arch. They are the common digital palmar arteries and nerves, and these divide into two, supplying both the sides of the fingers, you can see, and the ones on the finger are known as proper digital palmar arteries and nerves. And after removing the superficial muscles, now you can see this is the deep palmar arch. So just to show you, this is the extensor compartment of the forearm. So on the posterior side, or the extensor compartment, this is the medial side and this is the lateral side. So this one right here, I have removed the superficial muscles already. So this is the recurrent introitious artery, posterior introitious artery. This is the posterior introitious artery, recurrent introitious artery,